and I'll talk you through the agenda. And so what we have planned for today is we'll have a welcome in session purpose overview, and then we'll have a story with a lived experience, a real life health, heart health story, and then we'll have some peer sharing and reflection. And and then our guest speaker, Dr. Florence Champagne, she'll talk more about understanding heart health risk and early screening, and then any questions that you all may ask. As at the closing, we will share the evaluation survey. We are offering an incentive for you all. It's a wellness journal, and the first 15 participants to complete the survey and indicate your interest, we will send you a copy of that wellness journal as well. And so with that said, I will continue with the presentation. And if you don't mind introducing yourselves and putting your names in the chat, and your location, and so that way we can know who's joining us today. Okay. We'll keep going. Yeah, just introduce yourselves and so we can all know who's here. And so today's session is designed to share real life experiences related to heart health, increase your understanding of heart disease risk before symptoms appear, provide plain language information about calcium score testing, and support informed, confident conversations with your healthcare providers. Excuse me. And so what is the Maryland Healthy Heart Learning Collaborative? As I mentioned, this is a program of the Maryland Department of Health, and basically it's a statewide coalition. And what this coalition does, it brings together health and community partners, but then also individuals with lived experience, so lived experience as patients and caregivers, and also family members. And our goal is to support learning, connection, and your practical action to prevent heart disease and improve heart health across Maryland. And so why does this matter? This matters because heart disease in Maryland, and this is according to the Maryland Department of Health, heart disease is the #1 cause of death in Maryland. And stroke is the third leading cause of death in Maryland. And so many of these outcomes can be prevented with early awareness, education, and action. And who is this session for? This session is especially relevant to you if you have a family health history of heart disease, if you are currently living with high blood pressure, diabetes, or another chronic condition, if you have ever had a screening and you were told everything looks normal, but you want more information. If you care for someone with heart disease, and if you want to take action before warning signs appear. So why early detection matters? Heart disease doesn't always come with warning signs. And our guest speaker, she'll expound on that as well. And so many people feel healthy before a heart event, and risk can build quietly over time, and traditional tests may not always show early risk. And so early screening helps identify risk sooner when prevention and treatment can be most effective. And so with that said, I'd like to introduce our guest speaker. I am pleased to introduce Florence Champagne. She is a member of the Maryland Healthy Heart Learning Collaborative. She is a heart attack survivor and patient advocate who is deeply committed to advancing heart health awareness and early detection. Florence is the founder of the Open My Heart Foundation and has played a key role in heart advocacy in Maryland. Her work has been recognized nationally, including receiving the Presidential Volunteer Service Award from President Biden and Vice President Kamala Harris. She is an international speaker and advocate and is based in Prince George's County, Maryland. Rather than telling her story, I'll turn it over to Florence to share her experience and the insights she hopes will be helpful for all of us today. Florence, thank you for being here, and the floor is yours.
Thank you so much, Shanta, for having me. Whoops, can you see me?
Yes.
Oh, okay. Thank you for this great opportunity. As she said, I am a heart survivor first and foremost. And let me just tell you a little bit about my personal experience. I did not have the typical heart attack signs and symptoms. It developed over time. So, with that being said, it was shortness of breath over time and until I couldn't breathe. And I would go back and forth to the ER, and I was dismissed. I was not listened to or taken seriously. And I was told that it could be stress and anxiety. So basically, I found that I was not alone, that this often happens with women. And so I believed them until it got progressively worse. By the time I got the help that I needed, my main artery was 99.9% blocked. By that time, they were rushing me off to the operating room for emergency open heart surgery. And after my journey, I felt as though, I was looking for answers. Why did this happen? No one caught it before, and things like that. I should say at the time I was unemployed and uninsured in between jobs. So I didn't know that insurance was a factor in the type of diagnostic test you receive. So, I thank God he spared my life, and I found out that the insurance was a factor, and I found out different types of diagnostic tests that I could have had to as an early detection of heart disease. So I put on my social work hat and became an advocate for not only myself, but for others as I listened to their stories or similar stories of either being misdiagnosed or not receiving the proper treatment or test. So that's a little bit about my background. I do represent other women that have similar stories and advocate for them when it comes to getting the health justice that they need. I hope that that tells everyone a little bit about my story.
Does anyone have any questions for Florence? Yes, Lisetta.
Hi, I'm Lasita. That's why I put it like that.
I'm sorry, Lasita.
That's okay. I'm used.
Hi,
Um,
Lasita.
Hi. I just want to say, Florence, I love her. I know her very well. All that she does for the community and her story is awesome, and I am honored and glad to be here, in her presence as she is the speaker for this evening. So I don't really have a question. I just want to say it's a pleasure for her to see her because she is an awesome lady. And I'm a heart survivor as well. So she knows my story. I actually flatlined and died in front of my house in December of 2015. And I have a story that is unbelievable. And I thank God every day.
And
Thank you
feel
so
free if
much.
yes, thank you. And feel free, anyone, if you want to step, this is a step up. This is a peer learning session. So of course we have some facilitated content, but this is also an opportunity for support and for you all to learn from each other as well. And if you feel comfortable, please do share your story as well, just so that
Okay.
other people can know that they're not alone.
Yes, absolutely. So I just wanted to also say, as a disclosure, someone is asking, who do we recommend? And I know we're going to have Q&A at some point. Um, but I do not recommend doctors or places that you should go to. There's a list of doctors through your insurance providers, you can always get that from them as far as where do I go to get a calcium score test. I would start with your primary care physician and ask for a recommendation for that. And so I know we're going to get into calcium score tests a little bit later. So at this point, I'll turn it back over to you, but I did want to share a little bit about my background and how signs and symptoms are different for women as opposed to men. And so mine was not really all of a sudden I had a heart attack. It was gradual over time. My artery was closing up over time. I knew something was going on with me as I started to sweat and things like that. I just went about my regular day because by this time I had been to the hospital maybe 5 or 6 times. And after you keep going back and forth, and no one is listening to you, you get you get kind of discouraged and feel like, well, maybe it is all in my head. So it wasn't until I finally collapsed that they then took a closer look and took me seriously. But it went on for about a year of me with the artery closing up and not being able to breathe. And so I would have my bouts and periods of off and on feeling fine, and then sometimes with the night sweats and things like that, and not feeling so fine.
Thank you for sharing that. That's very important to know. I do have some questions for everyone. I shared them on the screen, but I also have them in the chat. And I just like to know what stood out to you from Florence's story. Is there anything that you can relate to, or is there something that just really stood out to you that you can take heed to, or that's just really something that you might want to act on? Lasita, it's silence and you never know. Dr. Michelle McCoy, how doctors dismiss your symptoms, saying you're fine, fine, fine.
Absolutely. I heard
And
that a lot.
Amina Harvey, the importance of advocating for your health when providers ignore your concerns. And even maybe having an advocate, someone with you to help you to communicate and to advocate on your behalf.
Mhm. Awesome.
Yeah. Okay. So, has anyone uh, ever experienced this, or is there someone that you care for that has experienced this as well, or experienced something similar? Okay. I see one person says yes.
And
Okay.
let me just add to that the signs and symptoms are different. So it may be something that you don't know is heart related. So, for example, I know we're going to go over some of the risk factors, but it's something as simple as lower back pain could be a symptom that something is going on with your heart. And so studies have showed this in women. Something as simple as feeling nauseous could be a symptom that something is going on with your heart. So the signs and symptoms are a little bit more vague. And so people may not feel like, oh, yeah, that happened to me, but you may have experienced some of those things if it wasn't like an outright heart attack. So these are things to look for. And I've had people go and get themselves checked out after hearing me to say, you know what, heart disease runs in my family. I've been feeling this way. Let me go and see if it's heart related.
Okay. Um, Dr. McCoy says a typical walk with my dog became difficulty where I would be out of breath, like I was out of shape. Yes.
Yeah.
And for the before we move on, because I know Dr. Champagne, Florence, you have a lot to share. For the participants, what questions does this raise for you about your own heart health, if you're open to share? And feel free to unmute yourselves too. Chat or unmute is fine. Just giving you all some processing time there. And so I will begin to share the screen, and Dr. Florence Champagne, pass it over to you. So you're muted.
Thank you so much, Shanta. Understanding heart health risk. What do we mean by risk? What are some of the risk factors? And I also want to add to this, what are some of the modifiable and non-modifiable risk factors? For example, family history. That is a non-modifiable risk factor. You cannot do anything about your genetics. So if it runs in your family, high blood pressure, diabetes, those are risk factors that are non-modifiable. You can't do anything about that. Diabetes is a risk factor. You are at greater risk for heart disease if you have diabetes. Let me just go over to high blood pressure. That is a risk factor for heart disease, high cholesterol, stress, lifestyle, and smoking. But let me just say that another like non-modifiable risk factor that's not on the list is age. So as we become older, those who are 70 and older are at greater risk for heart disease as you become older. I mentioned family history, your sex. Okay, men have a higher risk of heart disease earlier, and women's risk for heart disease rises after menopause. And I also mentioned the genetics, that's inherited conditions. Even though it may run in your family, that's only 10%. So you may have a 10% greater risk because it runs in your family. Now, let me talk about the modifiable risk factors. That's something you can do something about. High blood pressure. You can do something about high blood pressure. So this is largely reversible. If you know what your numbers are, you can take medication. You can decrease your salt intake. Having diabetes and being overweight, that is something you can do something about. So that's modifiable. An unhealthy diet, that is modifiable. You can start to eat right at any time. And when I say eat right, decreasing the amount of animal fat because that leads to high cholesterol. And then stress. We can do something about stress. So those are some of the things that are modifiable and help to prevent heart disease as you're looking at what the risk factors are. Any questions about that, or do you want to keep on going? You can go to the next slide if there's no questions.
There are no questions. However, there was a comment in the chat about sometimes runs in the family, sometimes it's behavioral, habits. So I just wanted to uplift that comment in the chat.
Awesome. Thank you. What is calcium score testing? So we are so proud to have pushed for legislation to be passed for calcium score testing. It's a non-invasive test. As you see a picture of it, you go through the machine and they detect any calcium buildup in your heart. It's very quick, non-invasive. It measures the amount of calcium buildup in the arteries. And calcium buildup can be a sign of plaque and lead to heart disease. This is something that is a preventive measure or early detection for heart disease. But by the time we have heart disease, we've had a stroke or we've had a heart attack, it's usually too late. So our issue with calcium score testing and these types of screenings is that we should have them early on, just like we do with breast cancer screenings. Believe it or not, that was a law that was passed that everyone after a certain age be offered breast cancer screenings. You might get a call on the phone or saying it's time for your mammogram. Well, we want the same thing to happen with heart disease because heart disease is the leading cause of death. However, we're not being asked about screenings for heart disease currently, but due to the bill that was passed that we championed for, now it has become law. But people, we have to have an education and awareness campaign because people still aren't aware that this is now available in the state of Maryland. Next slide, please. Who may benefit from calcium score testing? Calcium score testing may be helpful for adults with risk factors. We talked about some of the risk factors, but no symptoms at all. You're walking around, you're feeling fine. So they call that being asymptomatic. So one of the things that we push for in the legislation, in the bill that was written, is for you to be able to get a calcium score test and have it paid for by your insurance providers, even if you're asymptomatic. That means no symptoms. Okay, so another testing may be helpful for is people with a family history of heart disease. And individuals told their test looks normal but still feel concerned. So after going back and forth myself personally with several tests, I was told constantly that you are fine. Okay, but I was not feeling fine. So we do have to become better advocates, even though you're told you're fine, your test looks fine. I had a stress test, I had an EKG, I had the basics. But there's other tests they can give you that would tell a different story. So your doctor can help make this determination, but sometimes you have to push a little bit for the right test and have an advocate with you. Next slide. Why screenings matter even without symptoms. Heart disease can be a silent killer. We're walking around, we could be a ticking time bomb. One person, we have galas every year and we give awards to the survivors, and I often interview them. And so one survivor was like a vegan for 30 years. She's like, how did I have a heart attack? Because I've been eating healthy. Like for the past 30 years, I don't eat any meat. It's a silent killer. Stress is a factor. She was also a caregiver for her husband. So these things take toll on your body eventually. They have something called the broken heart syndrome, where you die. You could have a heart attack before your loved one passes away because of the stress that it causes on your heart. Early knowledge allows for prevention, not just reaction. So it's good to know what your numbers are, know what your risk factors are, control the amount of stress, and of course to eat right. But there's other factors as well. So screenings can help as guide you through some of the lifestyle changes. Even when I think about lifestyle changes, I think about caregivers, becoming a caregiver. Like if you're in your 50s or 60s, you might have parents in their 80s or 90s, and now you have that responsibility. You may be a caregiver or your husband or whoever. And so some of these things help to create more stress, and you may need support systems in place. So that's one of the things I talk about. Knowing some of your risk factors can be empowering. Next slide. So here's what we talk about Maryland's new law. It's HB 666, no pun intended, and SB 60. So that's House Bill 666, and they just give it a number, whatever the next number is. And it's Senate Bill 60. So that means it was cross-filed in the House and in the Senate. And what that means now is insurances in the state of Maryland, Medicaid, Medicare, the different insurance providers are required to pay for calcium score testing. And so, believe it or not, when they came out with, it took 40 years for breast cancer screenings to become law. 40 years, everyone had to be on the same page and agree that we should start calling people and women should have breast cancer screenings annually. Well, we want the same thing to happen. We want calcium score testing and heart screenings earlier on, even with no signs or symptoms. So that's why we push for this legislation, because I was constantly told, you look fine, you look fine. So I thank God now it is law and it's required coverage in the state of Maryland. It was effective January 1st of this year, and it applies to Maryland Medical Assistance Program and many other health insurance plans. Okay. Certain Maryland regulated health plans must cover calcium score testing. Coverage applies when the test is ordered or recommended by a provider, and the purpose of early detection and prevention of heart disease is for the purpose of early detection of heart disease, and not a diagnosis after the symptoms appear. So that's very, very important. It's early preventative measure. And so this is something that everyone can ask for. And just saying, if I want a calcium score test, tell your healthcare provider. You can say it runs in my family, or I haven't been feeling right. You can be asymptomatic, and they are required to give you a calcium score test. However, we're trying to make it so that through education and advocacy and awareness campaign, we're trying to make it so that it is offered to you, that you don't have to ask. Next slide. I see some things going on. I'm not sure if people are talking. Okay.
I checked the chat as well. I don't see anything.
Oh, okay. What this
But
means for you. Oh,
Tamika, she says this is awesome legislation. Congratulations.
thank you, Tamika. That's Dr. Tamika in Philadelphia. I know her. What this means for you, practical takeaways. Calcium score testing may now be covered by your insurance. You have the right to ask about this screening. Coverage supports prevention and early detection. Okay. Always confirm the details with your insurance provider. Maryland's laws does not require you to meet a strict checklist. As I said before, you can be asymptomatic. Coverage is based on a conversation between you and your healthcare provider about your risk and whether calcium score testing makes sense for you. Okay. So this is something that I'm really passionate about. I'm trying to educate people about that this is something you can ask for. And when I do, people go and get the test and they call me up and thank me for letting them know about it. Sometimes there's 70% blockage, sometimes there's less. It was explained to me by the cardiologist that we're all walking around with a certain amount of blockage in our arteries. We just don't know the amount. So it's good to know what your numbers are, just like what your it's good to know what your blood pressure numbers are, it's good to know what your calcium score is. Okay, next slide. Talking with your doctor. Start the conversation. Helpful questions to ask. Based on my risk factors, should I consider a calcium score test? Whoops. Yeah. So these are some things you can ask your doctor. And let me just tell you, believe it or not, my brother was recently in the hospital in Philadelphia, and he has asthma. And so it was a situation where he had shortness of breath. But when I saw him and I went to the hospital, I said, "Have you had a calcium score test?" He said, "No." I said, "Has anyone done a cardiac workup on you?" He said, "No." I said, "Wait a minute. So you need to have, at the minimum, a calcium score test. I can tell by the way that you're breathing." Sure enough, he had plaque built up in his arteries, and he now has to go for open heart surgery. He had 70% blockage. I should not have to tell him that, but it was something that was not offered to him. And now he knows we have a family history of heart disease. They should be giving you some type of cardiac screening. But since he went in there talking about the asthma, it was related to the asthma and things like that. I mean, that may have been a factor, but education is key. When you know better, you can do better. So he's now on a corrective path and a corrective course. What does my family history mean for my heart health? Yeah, just like I said, it's a family history of heart disease in our family. So I'm glad I went to see him, see what he looks like, how he was breathing. And I'm not a doctor or anything, but I knew that it was heart related. What steps can I take now to lower my risk? So, exercise and diets and things like that. You can talk to your doctor. I kind of feel like, doctors may tell you what the right things to do are. You have to eat right, or things like that. But as a patient, you may or may not listen. But over time, if you're paying attention to your health, how can I stay on a good track? I think knowing the numbers are alarming once you get something like a calcium score test. And so then you have some ammunition, you have something to go back to the doctors with and say, "Hey, I don't want to be on this path. I know I can turn things around. How can you help? How can you help me?" And that starts a good conversation. Next slide.
Before we move on, are there any other questions that anyone would recommend that you ask your doctor, or questions to help start the conversation?
And a good way to start is just by saying, heart disease runs in my family. Can I take a test? Or what other, you know, even with the all the tests that I had initially, um, it's sometimes good to ask, is there another type of test you can give me? Because when I had the test, it didn't reveal anything. So I didn't know about a cardiac catheterization, and that is an expensive test to have. It wasn't until they did the cardiac cath that they found out that my main artery, the LAD, or the widowmaker, they call it, was 99.9% blocked. Some people have 100% blockage. So one test may not, a stress test may not reveal the full story that's going on with you. So sometimes it's good to ask, is there another type of test that you can give me?
And in this case, it's inquiring about the calcium score testing, but then also sometimes there's a difference between an ask and a request, right? And
Right.
so, and even if you do have pushback, and this is where that self-advocacy comes in that was talked about by some of you all in the chat, or even having someone with you to help to advocate on your behalf. And this is where you're requesting the testing, right?
Right.
And if there's an issue with coverage, then you can definitely reach out to your to your insurance provider, because as Florence mentioned, this is also about not just educating the public, but then also educating the providers as well. And so remember, this is Maryland law, effective January 1 of this year. And so, you know for yourself, and and you can share and pass this on to others.
Right, right. And let me just say, sometimes your doctors become your advocates. So at the time, I remember collapsing in a public building, and I really felt strongly that I'm not going back to the doctors because they're going to think it's all in my head. But I couldn't breathe. And I called a physician that I just met, and he guided me to a colleague of his in that area where I was. And the colleague said, "Well, I don't think it's anything, but Dr. So and so wants us to cath you." That's a cardiac catheterization. So that doctor then became my advocate. So sometimes you need an advocate, someone who's fighting on your behalf. Okay, peer
Perfect.
Q&A discussion. Okay.
Yeah, and so we do have some questions for those of you who cannot see the visual. The questions on the screen are, what questions do you still have? What information was most helpful today? And how might you use this information moving forward? And so let's start with what questions you still might have. I'll stop sharing my screen. Yeah, I'm checking the chat. Uh, Dr. McCoy says, I had a calcium scoring test completed on January 2nd, 2026, in which the medical facility made me pay $140. I will be reaching out to my insurance company. Okay, great.
Are you in the
Uh,
state of Maryland?
Yes, I live in Upper Marlboro.
Oh, okay. Yeah. It's required coverage now.
I guess the medical facility didn't know at that time because it was just the day after it became law, and so they made me pay 140. But I will be
Mhm.
reaching back out to my insurance company.
Okay. All right.
and then there's a question, at what age is the requirement for testing?
I can't answer that. I do know that with I don't even want to guess, but if you're feeling a certain kind of way, you should talk to your doctor and see when is a good age. We know, I believe it's in your 40s, but I know people who have had heart disease in their 30s and even if in their 20s. So it just depends on your family history and the type of heart issue that it is.
In addition to your family history based off of. And so this is my interpretation. I did read the law, and as mentioned in Dr. Florence Champagne's slides, the state of Maryland in the law, it doesn't have a strict checklist. And so that's why it's important to have the conversation with your doctor, because let's say someone is under the age of 18 and has some of those risk factors that were discussed, and a family health history, that may be something that can be requested. So I think so. This is the educating yourselves, and that's why you're here, and that's what you're doing right now. But then also taking that education into advocacy and to ask those questions. So again, I would say that would be a conversation that you have with your provider. And then there
Right,
should be, typically when a provider orders any type of test, they have, their code or their justification for why why you're doing the testing. And so I'm pretty sure, not pretty sure, there may be an opportunity or a need to, if there is a billing issue, to contact your insurance provider as well. It might be just because it's new, it may be some advocacy there, but that's why individuals like Florence Champagne, they are advocating to educate you all.
right.
Um,
And I would
And so,
say that
mhm.
say that it runs in my family. You can say we have a family history of heart disease or and high blood pressure and high cholesterol. Those are justifications for it as well.
And then, Lucida, for a person who has had every test and came out negative, but I do now know my situation, should I ask for a calcium test just because?
I would say absolutely yes, and it has to be covered in the state of Maryland now.
And Dr. Michelle McCoy, she's sharing, my 89-year-old mother has heart failure. Heart disease does run in my family. So definitely that would be a reason for the calcium score testing. Okay. Um, any other questions? Because I have some questions for you all. I would like to know what information was most helpful for you today.
Hi, this is Marion. Everything was very helpful, and I've learned to, try to open up dialogue with my physician about getting the screenings that I need for checking the calcium.
That's great, Marion. Thank you for your comment.
You're welcome.
Yeah, yeah. So opening up that dialogue is important. And let me just say a little bit about my experience. Oftentimes, doctors may be looking at their computer or looking down at a piece of paper. You're just, another number, and they may have to move on to the next person. But we have to slow down our doctors when we have those doctors' visits and ask and be prepared for your appointment and ask some questions. And that helps the doctor slow down and really focus and pay attention to you and your concerns. I hate to say it, but every doctor is just not the same. And meeting with doctors and having this organization, they may feel as though you don't care. You don't care. You're not going to listen. You're going to go out here and eat whatever you want and things like that. That's what some of the doctors have said. So they may not spend that time with you. But you've got to be prepared. You have to have some feedback. What does this mean? I'll try to say it real briefly, but once after I had my heart event and my open heart surgery, I went to a doctor that I was not familiar with, and I asked them. I had some type of test, and I asked for the results, and he said, "Oh, you're fine." I said, "Well, what does that mean? I'm fine. What do the numbers say?" He had to go back and get his paper to see what the scores were because he didn't have anything in front of him. And then when he came back, he said, "Oh, I see that there has been a change." I was able to come off of one of my cholesterol medications because yeah. So sometimes you're just a number, but you have to have this dialogue between your doctor so that he knows or she knows you're intelligent. You can ask intelligent questions. It's a feedback, it's a give and take. Don't just take something for, whatever they say and you just walk away and believe it. No, let's have a conversation. How do I get my numbers down? How do I get on the right path? What are my numbers? Because the doctor didn't even have the numbers in front of him when we spoke. So they didn't know I was an advocate. I was advocating for myself. So you have
Okay.
to become a better advocate and be a little bit armed. It's with information because it's a lot of information out there for you now. So know what you're talking about when you go into the doctor's office.
Okay. Thank you.
You're welcome.
Yes, so it really helps to like write down your questions in advance because sometimes in our heads we know what we want to say. Um, and why we want to say it or what we want to ask. But sometimes just writing those notes down, it helps us just in case we get the jitters or we get nervous when we're meeting in person with our providers.
Right.
There are some comments in the chat. And so Lauren says finding out that the calcium test is covered by insurance is a takeaway for her. And my husband is having that done next week. Thank you. And
Yes,
so,
yes.
yes, thank you. Thank you. And Kim says that thank you for this information. I never heard of this screening test. So this was this is good news for us as well. And then Marion says the calcium score testing information was helpful. I had a CT of the chest without contrast a couple of weeks ago, and I'm wondering if that was the calcium score test. I will be asking my doctor on my follow-up. And Dr. Michelle says there is an untapped resource that folks do not use. It is someone that you see every month, your pharmacist. And
Oh, yes,
yes,
yes.
I am definitely an advocate for public health pharmacists as well. And Tamika says having an advocate with you also helps. I'm always on speakerphone with my mom when she goes to the doctor out of town. And then Dr. Michelle, we see you have your hand raised. Did you have something else? Did you want to unmute yourself?
That's Terry. That's one of my sisters. That's Terry Peters.
Okay. Terry, did you have something to say? Okay, maybe not. All right. And so I'll share my screen. We're at 6:54. And this is Terry. Terry, I believe this is Terry typing, right? That says knowing one score on the calcium scoring testing is important. The normal number is 0.
That was me.
Oh, that was you. Okay,
She
okay.
had a difficult time logging in, so I shared my link with her. So that's
Oh, okay,
she said
okay,
she
Uh,
can't get in. That's her saying she couldn't get in.
she
okay.
couldn't
So
get
you're in
in.
now.
Yeah.
Well,
So our key takeaways: heart disease risk can exist without symptoms.
mm,
Symptoms. Calcium score testing is a tool for early detection. Maryland law now supports access to this screening, and you have a voice in your heart health care. So those are our key takeaways for today's discussion.
okay. Can I just say, add one more thing, Dr. Tamika Quinn touched on? Take someone with you because sometimes when you're in pain or you're suffering, you cannot think properly. But I would take someone with me after I found out what was going on, because they become your eyes and ears and they can ask intelligible questions to the doctor for you on your behalf.
Okay. Thank you. And as it relates to next steps, we will send an evaluation survey to you all. So please do complete that survey. As I mentioned, participants who complete the survey, the first 15 participants who are residents of Maryland, and prioritization is given to patients and caregivers, but you will receive a wellness planner and we'll mail that out to you. Continue the conversation with your healthcare provider, with your family and your community. And then also the QR code is on the screen. We have 4 peer learning sessions that we're going to host, and I'll paste them in the chat. But the next one is Tuesday, March 3rd. And the topic is heart health between appointments. So managing medications, daily care, and nutrition. And our speaker is Angel V. Shannon, and she is a board certified nurse practitioner. So please, it's the same. The QR code is on the screen, and then we'll make sure that we add you to the mailing list as well for the upcoming peer learning sessions. I'll paste that in the chat before we leave. And then also, you are invited to join Dr. Florence Champagne. The Open My Heart Foundation is hosting their 4th annual Heart Health Equity Symposium in collaboration with the University of Maryland Medical System, Capital Region Health. It's at their location in the conference room number 1, located in Largo, Maryland. And so again, you can, if you feel like you wanted to get more out of today and to meet Dr. Florence Champagne in person. But then also, this is an opportunity to bring any other colleagues, family members, people that you care about to understand about the law, about more about calcium score testing, and just kind of like that peer and that fellowship. So that's going to be Friday, February 27th. It's a free event. It's from 1 to 3 p.m. And you can register at openmyheartfoundation.org. And the QR code is also on the screen there. And that's a picture of the wellness planner that we're sending out. And so I am actually going to stop sharing my screen while we still have a few minutes. I'll put the evaluation survey in the chat. And then also in the chat is the schedule for our upcoming peer learning sessions. And so again, this is a program of the Maryland Department of Health. And today's session is session number 1 4. Give me a second. I thought I had my evaluation link there. Give me un momento. There. Okay. So in the link, I just pasted the evaluation form. So if you all can take just a few minutes to complete that, you still have some time, about 2 minutes to complete that before we close out. And in the meantime, thank you everyone for attending. Lauren says this was so helpful. Thank you. Dr. Michelle, great session from the real Michelle McCoy. Tamika, thank you. She says great info. Sita, thank you so much. Excellent, she says. Dottie says, wonderful and needed information. Amina, very informative. Thank you for hosting a powerful educational session. Remember to wear red on Friday for National Wear Red Day for women in support of heart disease awareness. Thank you so much, Amina. And David Sean says, thank you very much. Yes, this is Heart Month. Okay. Bernice says, very informative session. Okay. And I'll put the link again for the evaluation survey. And so we are at time, everyone. I do want to honor and respect your time. This is thank you for sharing your evening with us. Thank you, Dr. Florence Champagne, for sharing your personal story. Thank you, everyone else, for sharing your personal story, for being open. Alexander Phillips says, thank you, really gained a lot. We encourage you to continue to participate in these ongoing peer learning sessions. They'll be on the first Tuesday of each month through May. And so we'll have different topics, okay? And different guest speakers. And so thank you, everyone, and enjoy the rest of your week and be safe out there.
Thank you. Thank you
Thank
for the
you.
opportunity.